One thing I think we all know is that if you do not brush your teeth, they're probably going to start rotting and then fall out of your face and you're going to end up in dentures. But this guy may have solved that problem. So this video came out like a year ago and you've probably heard of the guy. His name is Bryan Johnson. He's basically this multi-millionaire tech guy who is spending millions of dollars on just reversing his aging. His goal is to basically live forever. And he does some crazy stuff, things like blood transfusions, some weird drinks, and then these lasers. But in one of his videos, he talked about his terrible oral health. And as a dentist, I just had to watch. And I mainly just wanted to see, like, is the science accurate? And like, as a dentist, is this something that I would tell my patients to do? So with that being said, let's get into it.
It's possible I have the most extensive oral care of anyone on planet Earth.
Wow, that's a big claim to make. Now, I would think as a dentist, my oral care routine is probably better, but if this guy's spending millions of dollars on his health, his is probably better, let's be honest.
Today, I'm going to share what I do and what you can do at home to get your oral health in tip-top shape. And I'll tell you that I didn't start in a good place. My teeth were literally rotting. I was losing attachment on my gums. My teeth were not in a good place. I had a lot of sugar in my diet. The situation was not good. And you probably relate to this, that you maybe look at the teeth in the mirror and you're not quite sure, do you fully look or do you kind of close the mouth and wish for the best? You don't know if you go to the dentist, if they're going to do some big construction or they're going to have to repair a whole bunch of cavities. It's a really anxiety-inducing topic.
Yeah, so he mentioned a lot of things. So he mentioned how he had like attachment loss and he had like all these problems and he was scared to go to the dentist. And this is a reality for so many people. He's not unique in this. So many people have so much anxiety going to the dentist. And one of the big parts of dentistry is just easing the anxiety. It's not just about drilling and filling and doing these root canals, etc. It's about just getting people's anxiety out of there or trying to limit it as much as possible. Because our goal is to fix their teeth, get them out of pain, get people comfortable with seeing us again so that we can make these visits as easy as possible. Because the thing in dentistry is the longer you neglect something and the longer you wait, that construction project in your mouth just gets bigger and bigger.
Now, as with all things Blueprint, you want to take baseline measurements. I know when I've gone into the dentist previously, you go there, they do a cleaning, the dentist will come in, they'll give you a look over and say, no cavities, great, you're good to go. But oftentimes that misses some of the more important elements. So for me, we said we want to look at pocket depth, which is...
This is actually a perfect image explaining exactly what's going on. So one thing that I really liked that he mentioned is it's not just about the cavities. So you can go to the dentist and be told that you have no cavities, etc. But what I found interesting is he basically made it seem like it's not routine to do these pocketing depths and all these measurements. This is a routine part of dentistry. It's not just about looking at the teeth, you also have to look at the gums. So what we typically do is we take that instrument like you see going into the gums and we gently just go in and we see when that instrument stops and we take a measurement. And we measure this in millimeters. So typically like 1 to 3 is really good and healthy gums, but anything more than that can start to get a little dicey and a little serious. And what sometimes happens is you get attachment loss. So you also see like those little ligaments connecting the bone to the root. Those are your ligaments called your PDL. And if you start to lose those and you start to lose bone, then that number is going to get bigger. It's going to probably get like 4, 5, 6, or even higher. And that basically means you have so much inflammation kind of eating away at the structures that hold your tooth in place. And this can end up leading to you getting dentures or you end up losing all your teeth.
You take from the top of the gum to the bottom of the pocket and you want to see how deep that is. If it's 1 to 3 millimeters, you're in good shape. If it's
that's why I just said 1 to 3 is good. 4 to 5 needs some work, and it could even be a lot higher. I've even seen like 10 millimeter pockets.
The second is attachment.
And then attachment loss is what I talked about, like losing the bone and stuff.
Third is you want to see plaque index, the hardened plaque around the tooth.
So the plaque index, like the hardened plaque, is basically just called tartar or calculus, and that's what you need to get scraped off at your dental cleaning. Because when it gets hardened, you can't really remove it with your toothbrush and your floss. So you have to actually use those dental specific tools to scrape it off and keep your teeth clean.
And then you also want to measure how easy or hard it is for your gums to bleed.
The gums bleeding is a big one. That's actually the #1 factor that we look for in gum inflammation. So if your gums are bleeding, it's the #1 sign that your gums are inflamed. And a lot of times people tell me like, hey, I don't really brush my teeth or floss my teeth because they start to bleed, so obviously I should stop doing it. Like, obviously if I was cutting my hand open and my hand started bleeding, I would stop doing that. But with your gums, it's a little bit different. Whatever you're doing, like if you're brushing or flossing and your gums start bleeding, that means you need to keep doing that even more. And eventually, if you keep doing it for like a couple weeks, your gums should start to get healthier again and the bleeding should go down.
Now, once you have those baseline measurements, there's a rough idea where your oral health is at.
All right, let's get into his routine now.
The first thing I do in my protocol is I use a water pick.
Look at that, water flosser.
$50 to $200, but you see it's a high pressure stream of water that comes out like a hose, and you run it along the gum line around your entire teeth. If you brush and floss and then you use your water pick, you're still gonna see stuff come out. And so it really is effective.
That's really true. So brushing and flossing is one way to kind of keep your teeth clean, because brushing will kind of clean the outer surface of your teeth, and then flossing is like mechanically scraping in between your teeth. But the water flosser is kind of like a fire hydrant that goes in and kind of flushes everything out. Now, I recommend getting a water flosser that has different pressure settings, because some people, they can tolerate a higher pressure. Some people might need to start off with a lower pressure setting, but they all do different things. And in a lot of cases, water flossers will work better than floss for certain things, like around implants, or if you have like your wisdom teeth and they're causing a lot of inflammation, you need to clean around them. A water flosser is going to clean better than floss there too. Those type of instances, a water flosser will actually work better.
In getting your mouth really clean, I do this for the first step. Now, after water picking, flossing is number 2.
So now he flosses.
It has a more thicker string. I think in the studies we evaluated.
So what he's doing there's something called C-shaped flossing, where he's not just going straight up and down with the floss, he's actually angling it around the tooth and then going up and down and then angling it in a C shape the other direction to go up and down the tooth, and that's actually how you're supposed to floss.
It showed a 25% increase in the amount of plaque it could pick up from the smaller strands. I used to use Oral-B.
So I really like how you mentioned that. So I'm not really a big fan of that Oral-B floss either, because that floss literally will just glide right past the plaque and not really clean it up. So this floss that he's using, I actually haven't tried it yet, but I want to, because he said it grabs more plaque, and that's really the whole goal with floss. You want to grab as much plaque as you can from in between your teeth and underneath your gums.
I use both a water pick and floss because they're each good and helpful at picking up debris.
Yep, they both do different things, so it's good to do both, honestly.
Is I use an electric toothbrush. Now, I prefer the electric because
I'm a big fan of electric toothbrushes too.
But you may prefer a manual, and
I actually used to use that exact same toothbrush, and I'm going to tell you a little bit about it too.
I prefer soft bristles versus hard because I find...
So I don't know if he's just doing that brushing motion for the B-roll, but that's not exactly how you're supposed to use that electric toothbrush. You're really just supposed to hold it on every single surface of your tooth for like a few seconds. So like hold it on the cheek side of all your teeth, and then hold it on the biting surface, then hold it on the tongue surface of all your teeth. Now that specific toothbrush that he's using, it looks like something called an Oral-B IO. I had that exact same toothbrush. We had some rep come into our office and they gave us all free toothbrushes, and it was a really good toothbrush. The only problem is that toothbrush tends to pick up some mold if you do not clean it correctly. So I told this to the rep later. He's like, yeah, the only way to really fix that is you have to, like, every time you brush your teeth, you have to like take it apart, you have to dry it, and then like you have to like do these certain things to prevent mold from growing inside the toothbrush. And sometimes mold still can grow in there, so then you have to kind of take this instrument and kind of clean it out. And for me, that was just too much work for a toothbrush, and I think a lot of the other electric toothbrushes work just as good. So now I use a different Oral-B electric toothbrush, not that specific one, because I just didn't want to keep cleaning mold off my toothbrush.
It can clean just as well without the harsh friction. And then there's small things you can do. For example, you can wait 30 minutes after eating because your teeth...
Yep, 30 minutes after eating is good, because every time you eat, your mouth gets acidic.
Can be helpful. As for my toothpaste, I currently am using 2. I use 1 in the morning, 1 at night. There's no reason why. I just think it's fun to change toothpaste. Also, I try to get every single bit out of the tube because you know what? Why waste anything? These pass because they don't have fluoride.
Looks like he's using a Sensodyne. So he said a fluoride-free toothpaste. So we didn't really go too much into the toothpaste. Now, to be honest, most of the cleaning is done from your toothbrush and your floss and your water flosser, so you don't really have to spend too much time on your toothpaste. I personally use Colgate Total toothpaste, and it has stannous fluoride in it. If you want to know why I like stannous fluoride and compare that to the other types of fluoride, I'm putting a link in the description below if you want to learn more about that. But if you're using a fluoride-free toothpaste, if for whatever reason you don't want to use fluoride, I'd recommend looking into a nano-hydroxyapatite toothpaste, and make sure that that nano-hydroxyapatite has at least 10% in that toothpaste.
Tongue scraper.
Big fan of tongue scrapers.
Tell me about this. These are really important.
It's probably like the best way to prevent bad breath. Just get all that gunk right off your tongue. And it's super easy to use.
And so this tongue scraper, stick out your tongue, scrape it, do it a few times, and you will notice.
Yep, he described it perfectly.
Health. If this is not a practice you do today, I would encourage you to start it. Now for mouthwash, I've used this guy. It has xylitol.
So we did mention xylitol. So xylitol is really cool because it's the only sugar substitute that actively prevents getting cavities. So xylitol is really cool to have in your dental products and things like in your chewing gum.
And I only use it in 2 circumstances. One is when I'm about to be in close contact with others. to avoid having bad breath. We all know what it's like to talk to somebody with bad breath. And then secondarily is if you're about to smooch and you want to be freshened up, give your partner the very best.
And I honestly think so far he's totally spot on with everything that he's saying. With the mouthwash, you don't really need to use it. It's more as like a mouth freshener. So he's just using it when he's meeting people or if he wants to have some other fun time and he wants to make sure his breath smells good.
Next is bruxism. This is
a big one.
Near to my heart. For 20 years, I was grinding my teeth at night. So I'd go to bed, I'd wake up, and I would catch myself grinding my teeth. It was a really unpleasant sound and feeling, and I couldn't stop myself. I'd try to meditate.
That's the thing, you can't really stop yourself because you're usually sleeping whenever you're grinding your teeth. So a lot of times, like if you ask a patient, like, hey, do you know if you grind or clench your teeth? And they're like, what are you talking about? I never do that. But all the signs are there that they're grinding their teeth. They just don't know it because you're sleeping. Now that being said, there is a big component like not being able to sleep and things like sleep apnea, linking that to grinding and clenching your teeth. So if you want to learn more about that, I did make another video about that, so check out the description below.
But I just couldn't stop it. Now, if you have bruxism or you think you may have bruxism, I'm going to strongly encourage.
So he's going to show a specific device that helps him.
The dentist I spoke with would recommend a mouth guard of some variety. Sometimes
so that looks like an Invisalign retainer that he's talking about, but
grind my way through those. It didn't stop my grinding, it just created a cushion for my teeth.
So the image was just showing like a retainer, which just kind of holds your teeth. But typically like a mouth guard for grinding your teeth is something called a bite splint, which is a little bit thicker than a retainer. You just wear it on one arch, like your top or your bottom. And then that way, every time you grind and clench your teeth, it kind of deflects those forces and protects your teeth.
Still created the wear and tear. When you're grinding, it not only just creates wear and tear on the teeth, but also increases pocket depth. It increases attachment loss.
And that's true. So every time you grind and clench your teeth, it's not just doing damage to your teeth, it's also literally causing so much inflammation. So I think a lot of his like big pocket depths and like the attachment loss could have been from him grinding his teeth as well.
And so I didn't fix it until a dentist recently on Blueprint recommended this one, which is Somno Dent device.
Somno Dent device. Okay, cool. So it looks like it's like a mouth guard device, kind of like that bite splint, but it's also for helping sleep apnea. So it's kind of like two things in one. So basically the way it works is when you put that in, it kind of juts your mandible forward or your lower jaw forward. And that's something called like a mandibular advancement device. That's one of the treatments we do for sleep apnea. Because when you shift your lower jaw forward like this, it kind of opens up your airway and it makes it easier to breathe. So it stops some of that like obstructions when you're sleeping and helps you sleep better. The other cool thing is it kind of forces you to breathe through your nose because it keeps your mouth shut. So not only does it stop the grinding and it shifts your jaw forward to help open up the airway, but it also forces nose breathing, which is like three benefits in one, because I talk a lot about nasal breathing and why nose breathing is so much better than mouth breathing. There are a ton of benefits from nasal breathing, and there's a ton of problems that you can get from mouth breathing. Like mouth breathing can literally contribute to cavities and gum disease too, because it dries out all the saliva in your mouth and it makes you way more prone to get other problems in your mouth. And not only that, for your health in general, nose breathing is so much better. So this is a pretty cool device. The only problem is like when you shift your jaw forward like that, it can kind of throw off your bite. Like when you bite the next day, it can kind of like shift everything because it kind of shifts your TMJ, like the condyles, like where your joint in your jaw sits. So typically what you need to do is like the next day you need to kind of bite on something to re-establish your bite and kind of reset where your jaw joint is. Otherwise things can get messed up when you chew.
And what it does, it's a top and a bottom layer, and it arrests your mouth. When you first put it in, you feel claustrophobic because it just, you can't.
It probably takes a lot of getting used to.
It becomes very soothing. And so for the first time in my life, it's been able to arrest my bruxism, and it has stopped the decay of my teeth quality. And then of course, we all know this, it's wise to visit the dentist every 6 months or so to get a teeth cleaning.
Obviously, make sure you do not neglect going to the dentist.
Doing with our oral health. You may guess I have done some out of the normal things for my oral health.
All right, we're in the fun stuff. Let's see what other stuff he's doing.
Correct challenges you have. They are on my website.
Oh, so I guess you have to go on his website to see that stuff. So.
My markers have dramatically improved. My attachment loss is 41% better.
Wow, really good improvement.
Are as healthy as a teenager.
Wow, that's really good. Now I will say, like when you look at his smile looks really good, but probably from his attachment loss before, you see a little black triangle in between his two front teeth. That usually comes from like bone loss and having your gums pulled back. So that's probably from that attachment loss that he had, and it's probably stabilized now. He could actually get that corrected if he wanted to get like Invisalign or something done to kind of like smooth in the middle of those and kind of straighten things out. But if it doesn't bother him, he can just leave it like that and keep everything clean too.
Now for basic life decision making on a day-to-day basis, there are 3 simple ones to follow. 1 is avoid sugar.
Yeah, avoid sugar.
2 is be mindful that some people's teeth can be sensitive to acidic liquids.
This is a big one. A lot of people totally ignore this. Like they think like diet drinks or other drinks are totally fine because there's no sugar, but really it's the acid that's causing a ton of damage. Even sugar, it's not the sugar that causes cavities. The sugar feeds the bacteria in your mouth, which produce acids that will damage your teeth. So at the end of the day, no matter what is damaging your teeth, it's just the acid that's causing these cavities. So even acidic drinks with no sugar can do a lot of damage to your teeth.
Lemon water or caffeine, and so exposing your teeth all day long to that can be bad. And 3 is assess for dry mouth condition. Saliva really helps.
Dry mouth, we kind of talked about that before.
Mouth. So check with your dentist if you have a dry mouth condition to see if it can be addressed. So there you have it. There's a few simple things you can do. Water pick, floss, brush daily, see your dentist every 6 months, and then avoid sugar, and you're off to a great start.
Well, honestly, I'm pretty surprised. I think he did a great job. I agree with pretty much everything that he said in this video. And I think if you were to follow everything that he was doing, you would have a really healthy mouth too. So anyways, thank you guys for watching. If you haven't already, hit that thumbs up button and subscribe to my channel below. And if you want to see more of these like reaction style videos or something else you want me to react to, just let me know in the comment section below, and I'll see you guys in the next one. You're doing your best, or at least you're trying to do your best. You're cutting out all this junk food like potato chips and Sour Patch Kids, and you're trying to eat healthier foods and healthier snacks, and you think that it's healthier, and it probably is healthier, but is it really healthier for your teeth? Well, we're gonna find out, so make sure you watch till the end of this video if you really want to find out about